Let's study about median nerve. In the video of the brachial plexus, if you haven't watched it, go and watch in the videos. I have explained it very well. So, median nerve was coming from the two cords. That was the lateral cord and the medial cord. How it was coming? We had the mnemonics in the brachial plexus that in the lateral cord there was mnemonics for L and L. One L goes for lateral root or lateral branch of median nerve. Okay, and in the medial cord there was a mnemonic M, and U. M for U. One M was for medial branch of or medial root of median nerve. Okay, that's why it is having two cords. So if we will go and look for the root value, C5, C6, and here C8, T1, and here goes C7. So let's write it down over here about their origin. Okay, so what is the origin of the median nerve? That is lateral and medial cord of brachial plexus. Okay, root value is C5, C6, C7, C8 and T1. Let's write about their supplies, where they supply to. They supply to, okay, does they supply to the arm? No. Why? Because we have seen that in anterior compartment is innervated by the musculocutaneous nerve. And the posterior compartment, yes, radial nerve. What about the forearm? In the forearm, the radial nerve is innervating to the posterior compartment. And the anterior compartment, yes, seen by all anterior compartment muscles. Okay, all the anterior compartment muscles is innervated by the median nerve except the medial half muscles of what? Flexor digitorum profundus. Okay, it means it supply only to the lateral half of the flexor digitorum profundus. Okay, let's see, I will explain you afterward. So here what is there? Arm, no muscle, no innervation in the arm. In forearm, all the anterior compartment except the medial half of the flexor digitorum profundus. What about in hand? Does it supply to the hand? Yes, it supply to the hand. We have done the muscles of hand, right? In that video, I have explained you that all the thenar group are supplied by, yes, it was supplied by median nerve. Except adductor pollicis, okay, because it is supplied by ulnar nerve. Okay, adductor pollicis. And then lumbricals. Which lumbricals? L1 and L2. Okay, because L3 and 4 was supplied by our ulnar nerve. Then let's see how it comes all over the hand. Here are the distal end of our humerus. So, okay, the lateral and the medial cord is coming. Okay, and here in the arm we have some other nerves. How? Okay, I will explain. Give me a M, learn by these names, MBBS. M for the medial nerve. B for again brachial artery. Okay, B bicep tendon, and S superficial branch of radial nerve which come to the anterior side. So learn the mnemonics MBBS from median to the lateral. Okay, so how it is coming in the brachium and in the cubital fossa. Okay, now it will go all the way from the cubital fossa, and over here what was there? It will come and it crosses like this to the brachial artery. This is our brachial artery. It will cross and come to the median side of our hand. Okay, and then in the forearm there we will have one muscle, that is pronator teres. Pronator teres. It will come and get passing between the pronator teres. Okay, it comes between two head of pronator teres muscle. Okay, and then what it will do, it get bifurcate into two. So let's see here how it will give two branches. This is the anterior interosseous nerve. We remember that the posterior interosseous nerve was formed by the radial nerve in the posterior compartment, that is extensor muscles. Okay, here the anterior interosseous nerve is getting bifurcated by the median nerve in the forearm. Okay, and it's supply in the muscles we have superficials and deep muscles. Okay, all superficial muscles is taken by our these main branches, and deep muscles are innervated by the anterior interosseous nerve. This is anterior interosseous nerve. This, and it will supply to what? It will supply to deep muscles, flexor digitorum profundus, pronator quadratus, and our flexor pollicis longus, that goes to our thumb. Okay, what about this one? These main branches will give to superficial muscle, that is flexor digitorum superficialis, flexor digitorum superficialis, flexor pronator teres, flexor carpi radialis, flexor carpi ulnaris, and flexor palmaris longus. Flexor digitorum superficialis, flexor carpi radialis, flexor carpi ulnaris, palmaris longus. But flexor carpi ulnaris is innervated by ulnar nerve. Okay, ulnar nerve. And I said flexor digitorum profundus only it is innervated by two nerves, that is ulnar nerve and the our median nerve. Median nerve will give only ulnar nerve. Ulnar nerve supplied which part? Medial half part. Okay, medial half is taken care by our ulnar nerve, and median nerve will give to lateral half of the ulnar nerve. Is it clear? The ulnar side, that is our little finger side, is taken by medial nerve. Okay, and the median nerve will give supply to the thumb area, that is our lateral half of this hand. Okay, and then so that's why this muscle is known as composite or hybrid muscle. We know that if any of the muscle is getting innervated by two nerves, that is composite or hybrid muscles. That is why FDP is composite muscles. Okay, now next here the main branch. This was the anterolateral nerve, okay, which goes deep to our hand, and this the main branch. Over here we have flexor retinaculum. Okay, before inserting to the flexor retinaculum, it gives one branch, and it goes deep to the flexor retinaculum, and again gives one branch, and then it goes to our thumb region, that is thenar and lumbricals. Over here it supplies it supplies to the palmaris cutaneous branch, okay, and the after the nerve which is originating after inserting to the our hand, that will be the digital cutaneous branch, okay, and then it supplies to the our lumbricals. Which lumbricals? L1, L2, and the thenar muscles, except adductor pollicis. Adductor pollicis is innervating by ulnar nerve. Okay, is it clear? Let's do it again. This is our innervation. Okay, the median and the lateral cords come and form the main, or we can say median nerve. It will come in the our arm area and cross the brachial artery and comes to the medial side, okay. In the cubital fossa, the medial most is the median nerve. After that, brachial artery, then biceps tendon, and then superficial branch of the radial nerve. We can learn it by mnemonics MBBS, okay. And then in the forearm we have muscles, that is pronator teres. It comes between two head of the pronator teres and in bifurcate into two, anterior interosseous nerve and the main nerve. Anterior interosseous nerve will go deep to the our forearm muscles, and it will supply to the deep muscles of anterior compartment, that is flexor digitorum profundus, pronator quadratus, and flexor pollicis longus. But there is one exception, that flexor digitorum profundus is taken care by two nerves. The one is median nerve. Median nerve will supply only to the lateral half of the our flexor digitorum profundus, and the ulnar nerve will be taken care to medial half of the flexor digitorum profundus, okay, that is to the our little finger sides. And then the main nerve will come and it supplies to the our superficial muscle, that is flexor digitorum profundus, flexor carpi radialis, flexor carpi ulnaris, and palmaris longus. But the muscle of the flexor carpi ulnaris is the muscle of anterior compartment, but it was not taken care by median nerve, but it is taken care by ulnar nerve, okay. Then it will give one branch and insert come to the our hand. For example, this is our hand, okay, and our muscle is coming like this way. Our muscle come like this way. It will give one branch. First coming like this. Okay, here is our flexor retinaculum. Our muscles come like this, and a nerve come like this before retinaculum, and it will form palmaris cutaneous branch, and it will enter the flexor retinaculum, and it will give one digital branch, okay. And then the lumbricals, L1 lumbricals, L2 lumbricals, and then the thenar group. Here is our thenar group. of the muscles except adductor pollicis. Why adductor pollicis? Because ulnar nerve will come like this. It will give hypothenar group L3, L4, and then the dead end, that is graveyard of the ulnar nerve. Which muscle is the graveyard of the ulnar nerve? Yes, the adductor muscles. Okay, so like this it will come, and the digital branch and the I will show the digital and the palmar cutaneous branch like this. For example, this is our hand. Okay, so we all know that our hand is giving 3.5, 1, 2, 3 and half. This is by radial nerve, and in that this portion is palmaris cutaneous branch, and the rest is this rest, half over here and one our first finger, that is by digital cutaneous branch. So understood the pathway and origin of the median nerve. Now let's see the injury. What will happen if there is any injury to our median nerve? In the median nerve, we can have injury at the high lesions. Which injury can occur at the high lesions and which will occur at the lower lesions? Let's see one by one. In the high lesions, at the near elbow, at the level of pronator teres. Okay, over here, pronator teres muscle here. If any of the injury occur over here, that is pronator teres muscle, the syndrome will be pronator teres syndrome. Next is at the fracture level. Where the fracture can occur? Yes, at the supracondylar fracture of the humerus. Okay, and then the third, Struther's syndrome. What is Struther's syndrome? We have learned this before. I said you it is not very common, but it is present in the animal, very rare present in the human. There is one extra ligament, or we can say of the biceps tendon. Biceps, we have two tendon, right? Short and long tendon, but sometimes in some 1% or less than 1% people have these. There is one more tendon present from the our posterior one deltoid tuberosity in the humerus to the medial epicondyle, and because of that over here we have median nerve. Because of these ligament, the median nerve will get compressed and we will find Struther's syndrome, and this ligament is known as Struther's ligament. Okay, and then in the lower lesions, where can be is lower lesions is our carpal tunnel syndrome near wrist, the most common carpal tunnel syndrome. Okay, so let's see what will happen, what signs we can see. Okay, at the level of pronator teres is getting affected at the level of this. If this is the injury place, okay, so all the muscles below this lesion will get paralyzed. There will be no flexion except what? Except we can see flexor digitorum profundus. Why? Because it is composite muscles. If median nerve is damaged, then too we have here ulnar nerve. Okay, so we can see the flexor digitorum profundus is working. Because flexor digitorum profundus is working, we will ask the patient to make a fist. Okay, he will or she will can't make a fist. So because FDP, half FDP is spared, half FDP is spared. Half FDP is spared. He can't make a proper fist, but the first finger, okay, will be not properly flexed. It will be in extension. So we can see, I will write over here. We can see pointing index. Why? Because half FDP is spared. Next, what we can see, the lesion is over here, and I said you, the thenar group affected, the cutaneous branch affected, all the flexors affected over here, but one muscle over here is left, that is adductor muscles taken care by the ulnar nerve. So here adduction is the spared, so we can see there is adduction. Okay, rest other thing is affected. There is no flexion, okay, but adduction is seen. So we can see our thumb will be in adducted position. So this is in adducted position. So this is this deformity known as ape thumb deformity. Ape thumb deformity. Why ape? Because it is not in our humans. It is present in the that monkeys. Ape thumb deformity. Next, what we can see? Yes, the normal sensory loss is absent. Sensory loss is seen. Okay. Now in the lower lesions. In the lower lesions, will the flexors affected? No, there will be no flexor affected. So, what about the injury is over here. So, thenar muscles affected? Yes, thenar muscles is affected. But does adduction is affected? No, adduction will be normal. So, in adduction, there adduction is present. So, ape thumb deformity is seen. Next, what about pointing index? Does FDP is spared? Yes, FDP is already spared because of these above injury. Because of FDP is from other nerve. Pointing index can't be seen over here because lesion is not at the level of the high lesions. So FDP is spared. So pointing index is negative. And the sensory loss will be present as injury because injury is at the level of carpal tunnel or flexor retinaculum. So the palmaris and digital cutaneous branch is also affected.